Colon cancer often begins silently, long before obvious symptoms appear. It usually starts as a small growth on the inner lining of the colon, called a polyp. Many polyps are benign at first, meaning they are not yet cancer. But over time, some polyps can grow larger and develop into cancer. As this happens, the tissue becomes more aggressive and more likely to invade deeper layers. The colon is part of the large intestine, and disease here can affect digestion, bowel movement, and overall health. One of the biggest risk factors for developing colon polyps is age, especially after 50. The larger a polyp becomes, the greater the chance that it may become cancerous. As a tumor grows, it can begin to narrow the passageway inside the colon. That narrowing can interfere with the normal movement of stool and fluid. One warning sign is a change in bowel habits that lasts for more than a few days. Diarrhea may happen because the tumor causes fluid leakage, or because stool passes around a partial blockage. Constipation can also occur as the tumor creates increasing obstruction. So both diarrhea and constipation can be warning signs, especially when they are new and persistent. When bowel habits change and stay abnormal, the body may be signaling that something deeper is wrong. Another important warning sign is blood in the stool. If bleeding happens low in the rectum, the blood may appear bright red. If the bleeding comes from higher up in the colon, the stool may appear dark red or even black. In general, the longer blood travels through the digestive tract, the darker it tends to look. The color and amount of blood can give useful clues about where bleeding may be coming from. Not all blood means cancer, but unexplained blood in the stool should never be ignored. A third warning sign is cramping or abdominal pain. Some patients feel a constant urge to have a bowel movement. That feeling may continue even after going to the bathroom. This can happen because the tumor blocks complete evacuation or creates a false sensation that stool is still there. The good news is that colon cancer usually develops slowly, often over many years. That slow progression gives doctors a chance to find polyps before they turn dangerous. One way to screen for colon cancer is a stool test that looks for hidden blood. Another option is colonoscopy, which allows doctors to directly see the inside of the colon and remove suspicious polyps. When colon cancer is found early, treatment is far more effective, which is why recognizing warning signs and screening on time can save lives.